Hello and welcome to LO5. Understand your role in assisting with the administration of medication. Are you ready to explore your responsibilities in supporting medication management within schools? In this video, we'll look at the key roles, policies, and procedures that help ensure medication is handled safely, correctly, and in line with legal requirements. Let's begin by exploring the essential framework that protects the health, well-being, and safety of every learner. Medication management in schools is a serious responsibility. 1 in 20 children in the UK needs medication during school hours. Errors can have severe consequences for the child and staff. Schools handle significant medication needs despite not being healthcare settings. Understanding this framework is crucial for safety. Schools must adhere to legal frameworks like the Children and Families Act. The Equality Act ensures reasonable adjustments for pupils with medical conditions. DFE guidance mandates support for pupils with medical needs. Human medicines regulations govern medication supply. Local policies provide additional guidance. Schools must have a Supporting Pupils with Medical Conditions policy. This policy outlines roles, medication processes, and emergency procedures. It is created with input from healthcare professionals and parents. The policy is reviewed annually and linked to other key policies. Staff must know this policy before administering medication. An IHCP is crucial for pupils needing medication at school. It details the pupil's condition, medication, and emergency protocols. Drafted with parents and healthcare professionals, it is signed by key stakeholders. It is reviewed annually or as needed. Staff must be familiar with the IHCP for trips. Administering medication is voluntary unless specified in job descriptions. Staff must be trained and assessed as competent. Healthcare professionals can administer within their practice scope. Designated staff handle routine administration. Parents can administer medication themselves if needed. Prescribed medication follows strict guidelines and must match the pharmacy label. Non-prescribed medication requires parental consent and specific health reasons. Controlled drugs need extra storage and record controls. Schools should not exceed prescribed doses without advice. Expired medication must not be used. Parental consent is essential before administering medication. Consent is specific to the medication, dose, and circumstances. Pupils over 16 can usually consent themselves. In emergencies, implied consent may be used. Consent must be documented, current, and accessible to staff. Medication must be stored securely, yet accessible in emergencies. Typical storage includes locked cabinets or refrigerators for specific medicines. Controlled drugs require double-locked storage and an access log. Inhalers and AAIs may be carried by pupils if appropriate. Expired medication should be disposed of safely. Before administering, check the IHCP for the correct details. Wash hands and use gloves if needed. Verify the medication container matches the IHCP. Apply the 5 R's: right pupil, medication, dose, time, and route. If unclear, pause until verification is complete. Confirm the medication with the pupil before administration. Administer the medication via the prescribed route. Observe for any adverse reactions. Record the administration immediately in the medication log. Return the medication to secure storage and communicate with parents if necessary. Asthma management is common in schools. Reliever inhalers are used during symptoms, while preventers are daily. Pupils should carry their inhalers with spares held centrally. Schools can hold emergency inhalers since 2014. Staff training is crucial to prevent avoidable asthma deaths. Rescue medication for epilepsy requires specific training. Only trained staff can administer buccal midazolam or rectal diazepam. The IHCP details when and how to administer. Post-administration includes calling emergency services and observing the pupil. Training involves practice and scenario work. Diabetes management involves blood glucose testing and insulin administration, staff support monitoring, and help with insulin delivery. Hypoglycemia requires fast-acting carbohydrates for treatment. Severe cases need emergency services and glucagon if trained. Schools must plan for diabetic pupils' needs. Anaphylaxis is a life-threatening reaction requiring immediate response. Adrenaline autoinjectors should be available for at-risk pupils. Schools can hold spare injectors for emergencies. Signs include breathing difficulties and swelling. Training ensures staff can respond effectively and save lives. You now understand the vital role of medication management in schools. Following policies and procedures ensures safety for pupils and staff. Stay informed and trained to maintain effective medication administration practices. Thank you for watching this video. If you have any questions, please call 07484361 688 or email the UKversity team, who are happy to help.